सर देखिए 2 मिनट कर दिया आप तो।
हाँ हाँ, दूसरा रूम मैंने लाइव कर दिया है, वो लाइव हो गया है। मैं आपको इसका लिंक भेज रहा हूँ।
और जितने लोग थे वो
रीडायरेक्ट कर देते हैं। वो प्रॉब्लम इसकी वजह से हुई होगी, हमारे पास 4 का लाइसेंस है। नहीं, वो वहाँ से रिडायरेक्ट हो जाएंगे। हाँ, ज्वाइन तो वहाँ पर करना ही पड़ेगा। वो तो करना ही पड़ेगा। मैं पहले तो आपको मैं इसका लिंक भेजूँ ना। हाँ, साहनी सर और आपको भेजना सर। आपको लिंक भेज दिया है, साहनी सर को नया लाइव का लिंक भेज दिया है।
नहीं हो रहा है। क्या बोल रहा है?
फोन के साथ कनेक्ट किया है। करूँ लैपटॉप के साथ एक बार चेक कर लो। बंद करूँ फोन के साथ बंद करो ना।
कभी आपका तो फोटो आ गया था। हाँ मेरा था। ये उसका हम काम कर रहे थे। वो अपना स्पीकर ऑफ कर दीजिए। हाँ वेलकम बिपिन जी। वेलकम बिपिन जी।
आपने जिस व्यक्ति को कॉल किया है वो अभी दूसरे कॉल पर व्यस्त है। हेलो।
Yeah, I'm in, huh?
हाँ वेलकम बिपिन जी।
Are you not in yet?
Yeah, I'm seeing Sahni, sir.
Are you able to say wait just letting you know call किया है? हेलो। आप आ गए होगे सर?
Yeah.
You're there. Yes sir.
Sir, मेरा am I audible?
हाँ you are
Am I
audible.
audible?
हाँ you are audible. Audible sir.
Yes, sir, you audible.
मुझे कुछ सुनाई नहीं दे रहा है।
Yeah. No, आप you are audible sir. You are audible.
Sir, I would like to request you. We'll wait a minute. I want to request the audience to kindly give us 2 minutes till our
एक मिनट,
chairperson.
I am not able to hear anything. Let me check.
Okay, sir.
Hello.
Yes, sir. Can
Hello?
you hear me, sir? Sir, do one thing. Just reload your page. Just reload the page from this on the status bar you have where the link is posted. Just reload from there only. Can you hear now, sir? You can remove the earphones and then try to listen. सर एक बार रिफ्रेश करके जो आई एम कॉलिंग यू आई रिक्वेस्ट द ऑडियंस टू प्लीज गिव अस अ
डॉक्टर बिपिन जी आपको आवाज आ रही है?
सर को आवाज नहीं आ रही है, शायद सर का इंटरनेट ग्लिच हो गया है। मैं एक बार देख रही हूँ। हेलो
सर आप एक बार बस रिफ्रेश कर लीजिए प्लीज,
क्योंकि मेरा आवाज नहीं आ रहा है। आपको मेरा आवाज आ रहा है?
आप आवाज आ रही है
पर आपको
नया लिंक ज्वाइन नहीं हो रहा है। मुरारी जी नया वाला में करने के लिए बोलो, नया वाला में
नहीं हो रहा।
फिर से रिफ्रेश करके करिए ना।
अब आप वीडियो
हेलो
Sir, please turn on. Yes, sir, you are audible. Please turn your audio on.
नहीं, आपकी आवाज नहीं आ रही है।
अभी आ रही है सर? अभी आ रही है सर आवाज? सर अपना वॉल्यूम फुल कर लीजिए लैपटॉप का। सानी सर, बाय द टाइम आप एक बार डॉक्टर कृष्णमुरारी सर एंड बाकी स्पीकर्स को पूछ लीजिए। मैंने सबको लिंक भेजा है बट ज्वाइन नहीं करा है किसी ने।
कृष्णमुरारी जी को नए लिंक में ज्वाइन नहीं हो पा रहा है। नहीं भी होता था।
हाँ सर, हाँ जी। और सहानी सर, मैंने सबको अपना लिंक, सर ये मत ऑन करिए, ये कौन चला रहा है? सर सर अपना वीडियो ऑन कर लीजिए बिपिन सर। थैंक यू सो मच सर। सर सानी सर, हम वेबिनार स्टार्ट कर देते हैं, बाकी लोग ज्वाइन करते रहेंगे। मैंने सबकी प्रेजेंटेशंस अपलोड कर दी है क्योंकि ऑडियंस भी वेट कर रही है। सर आपका ऑडियो ऑफ है।
नहीं, बाहर नहीं हूँ, ये शुरू कर।
डॉक्टर सुलेमान का क्या हुआ?
सर सबको ना, मैंने सबको अपना एडमिन लिंक भेज दिया है। वंस द पीपल ज्वाइन आई विल, सबको एडमिन लिंक्स भेज दिए हैं। वी कैन नॉट हेल्प, वो ज्वाइन नहीं हो पा रहा है उन लोगों का। तो मैं स्टार्ट करती हूँ। वील जस्ट टू स्टार्ट विद बिपिन सर एंड देन वील प्रोसीड फर्दर। इज इट ओके सर?
या
ठीक है। So welcome everybody. We are really sorry for the technical issues which happened due to delay and which resulted in delay of the webinar. So really sorry for the same. And yes, Dr. Shivang, we are going to change the order of the speaker, and then we'll, I hope whoever is having good connection, we'll be starting with that webinar only. So welcome everybody to today's webinar. And without wasting any more time, and as you all know that this is a webinar series we have started this is an international webinar on advancement in homeopathy. We have organized on the occasion of death anniversary of Dr. B. Sahni sir, and we are aiming that we try to extend homeopathy to achieve the target of ultimate medicine through this webinar series. So without any delay, I would like to request Dr. M.K. Sahni sir. As you all know, he's the man behind this webinar series, and I would like to request sir to please introduce our speakers and the chairpersons in short, and then we can begin the session with our first speaker. Over to you, sir.
Good afternoon, and sorry for some delay for today's program. We have just we have been waiting for due to some technical problems. So welcome you all, especially our speakers who are here, and our chairpersons for this webinar is Dr. Sulemani Aijaz sir. He's not in the room now right now. Okay, Dr. Sulemani is the principal at the MNH. He has completed his,
meeting चल रहा है.
He has completed his post graduation from the Jaipur Homeopathic Medical College, MPK Homeopathic Medical College, and he has very great academicians as well as a researcher, and he has conducted several research projects under the CCRH. I think he just not in the room, and so we'll start directly with our first presentations. Dr. Bipin Jain, as you all know, Dr. Bipin Jain is the principal and director at Dhawale Institute at Mumbai, and he's the director academic service of MLDHI and also the MUHS approved guide. Today he's going to take up with a very important subject on phenomenological understandings of the Medica. And without wasting time, I will request Dr. Bipin Jain to start his presentations. Over to Dr. Bipin Jain. Please start your presentations now. Please put on your mic. Your mic is off. On the top.
सर ऑन करिए, सर दोबारा ऑन करिए. सर आप एक काम करिए, बस एक बार रिफ्रेश कर लीजिए पेज दोबारा, 1 सेकंड में दोबारा जैसे पहले किया था दोबारा कर लीजिए. यस सर. सर मे बी सम टेक्निकल इशू इज देयर स्टिल. आ जाएंगे सर, आ गए हैं, ज्वाइन कर लिया है.
Can we start with Dr. Krishnamurari ji in the room?
सर आई थिंक डॉक्टर बिपिन का इंटरनेट इशू आ रहा है, तो पहले सर का ही स्टार्ट कर लेते हैं.
Start with Dr. Krishnamurari first now. So
सर डॉक्टर बिपिन ने ज्वाइन कर लिया है, 1 सेकंड शायद, बस 1 सेकंड लगेगा. उनका ज्वाइन आ रहा है लेकिन वो बस आने में शायद डिले हो रहा है स्क्रीन का. 1 सेकंड देख लेते हैं, नहीं तो फिर कृष्णमुरारी सर से स्टार्ट कर देंगे.
5 मिनट बताते हैं. हाँ पंकज चला गया.
Jessica ji, I think it's better to start the Krishnamurari ji. So meanwhile they are joining and getting talking.
सर ठीक है, एक बार आप देख लीजिए जैसे ठीक लगे ऐसे हो। सर स्टार्ट कर दीजिए आप, कृष्ण मुरारी सर को इंट्रोड्यूस कर दीजिए।
Technical issue with Dr. Jain. So we start our first speaker, with Dr. Krishnamurari ji, and he is a PhD from the Bihar University, and he is pursuing his postgraduate education. He has presented seminar lecture at Darjeeling, organized by Cancer Institute of Homeopathy, and also made presentation at the Freedom of Enablement. He has also young students, and I request him to start his presentation. Krishnamurari, now you can start your presentation.
Hello. Good afternoon to all of you. First of all, I would like to thank my mentor, Dr. M.K. Sahni sir. What am I because of his guidance and care. I am fortunate to represent myself and on the occasion of the death anniversary of the Dr. B. Sahni, who is the inventor of the transmission of God and energy from a distance. My topic of the presentation is the scope of transmission mode of administration in palliative care of advanced pathological cases. The presentation is dedicated to the Dr. B. Sahni, who is the great source of inspiration and discoverer of the Homoeopathy. Palliative care, the term derived from the palliate. This means to improve the people with the relief from the symptoms, pain and stress from serious illness, whatever the prognosis. The goal is to improve the quality of life for both the patient and the family, as they are the central care for the system. According to WHO, the WHO defined palliative care as an approach that improves the quality of life of patients and their problems associated with the life-threatening illness, through prevention and relief of the suffering by means of early identification and clinical assessment and treatment of pain and other problems, physical, psychological. Palliative care is focused on the providing relief from the symptoms and stress of illness. The goal is to improve quality of life for both patient and the family. Palliative care is based on the needs, not on the patient's prognosis. Palliative care are provided content and distressing symptoms, a one's life and regards dying as a normal process. It is neither to hasten or to postpone. Palliative care integrated psychological and spiritual aspects of patient care. Palliative care is useful in the case of incurable cases. While we are taking a like what should be the plan of treatment, what will be the how to select the proper remedy. One point in the mind, what is the proper case? Then follow up of the medicine. And many times we have to change the medicine according to the situation. Doctor incurable cases are source of great anxiety to every physician. but the physicians who follow the law of similars with the use of will give quicker relief than the
Krishnamurari
massive
sir.
doses of
Krishnamurari sir.
yes.
Sorry to
Yes, yes.
interrupt in
Yes,
between.
yes,
Can you
yes,
do me a favor? Can you do me a favor, sir? Your internet
yes,
is
ma'am.
creating some issue. Can you please refresh your page from above? Just reload the page and join again. In a sec, it will take a second only. On the status bar itself, there is a status bar जहाँ पे link लिखा आ रहा है. जहाँ लिंक लिखा आ रहा है उसके साइड में लिखा आ रहा होगा रीलोड दिस पेज. सर्कल बना रहा होगा सर.
कौन से साइड में?
सर लेफ्ट साइड में जहाँ लिंक बना रहे हो जस्ट लेफ्ट साइड में लिखा आ रहा होगा रीलोड दिस पेज. सर्कल बना रहा होगा.
नहीं सर्कल तो नहीं है
सर. ऐसा हो
सबसे ऊपर में है आपके कंप्यूटर पर होगा उसके ऊपर में उसको
सर जहाँ पे लिंक है ना आपका event.webinar.jam/live उसके जस्ट साइड में देखिए लेफ्ट साइड आपकी लेफ्ट वहाँ रीलोड दिस पेज लिखा आ रहा होगा. यस सर. Yes, Dr. Shivang, we are actually working on the audio. That's why we took a minute. Sorry for the delay.
हो गया.
हाँ जी डॉक्टर कृष्णमुरारी अब अपना वीडियो ऑन कर लीजिए. स्टार्ट कर लीजिए.
ओके.
Thank you so much.
Dr. H.R. Okay, thank you. Dr. H.R. said, incurable cases are the source of great anxiety, and every physician, but the physician who follow the law of similars with the use of single remedy in potentized form will give and the massive dose of narcotics and sedatives. Palliative care is this immediate support like change of potency, according to the presentation of the patient. By this mode of administration,
सर आप ना वीडियो ऑफ करके बोल लीजिए एक बारी.
Okay.
अब बोल के
By the
देखिए.
process of the administration of drug. Okay. By the process of administration of drug. Without the continuous process, medicine until the hair. In case of aggravation, it is only detach the hair from the vial and it will check the aggravation. Frequent change of medicine according to presenting features of the patient. So for the change of medicine, follow is very easy. Patient need not to come our clinic at the time. He only needs to inform us mail or message. Change of medicine is so simple. After 1 year, put the hair into another medicated vial. Drug transmission proves to be in comatose patient at ICU. Using times while the patient is comatose or in the ICU, this mode of administration is applicable. Here I an example case of the distance mode of administration in a internal case. This is a case of carcinoma of the glands of neck. Of Khagaria district in Bihar, India. Detected case of cancer of the neck, creating with husky eyes. There was 110. Just was started to fuse. It was unable to chew, and it was created. Some pictures select the medicine after taking it. As per Himalayan guidelines, we taking properly case present receive and so on. Like the Himalayan guidelines completely, and after the analysis of the classification points and following rubrics are selected. The cancer sections, general food and drinks is desired because at that time and also desired general food and drinks suits a person with a glance of mouth odor offensive, throat pain by symptoms, chill, eating after, mouth cracked tongue, fissured center, head pain burning, throat, swallowing difficult, especially solids, mind mildness, sleep disturbed by pain. This is the repertorial analysis of the case, which is repertorized by the radar opus software. And after the repertorization and repertorial analysis, we concluding the medicine is selected on the basis of totality is the nitric acid. And nitric acid 0/1 was transmitted through the hair on 16/9/2019, and the next follow-up come on by the attendant on phone on 18/9/2019. The patient reported that burning was reduced to minimum. There is no change in discharge. Discharge is as it is, but the pain is reduced. The second follow-up is come on 21/9/2019. Patient reported to reduce discharge with no pain and voice was very much improved. And gradually the patients improve and treatment will be continued. Now the point of discussion is in this case, the cancer patient was unable to take medicine properly. Attendants were very much upset with her serious distressing pains and discharges. They found this mode to be useful as it do not require repetition and manage of dose. Because in case of particularly cancer and other life-threatening illness, there are multiple types of medicine and repetition more and more times required. So here no requirement of the repetition and no requirement of the regulation of medicine by the patient or attendant. It is observed that during this acuteness, distant administration of medicine finds a better results. With our experiences in several such cases in clinic, it giving very encouraging results. Not only in these cases, there are so many cases we are seeing that it is very useful. This method. Palliative care are often put our patient to test endurance and adherence to principle. Using patient and confidence in own abilities and principle, we can overcome such distressing states and following forward to bring curative results. Even life-threatening illness or the incurable cases, if we follow our principle similia, it is very simple to select the medicine and apply it to the patient, or we get results very satisfactory. Dr. B. Sahni's discovery, transmission of homeopathic medicines from a distance becomes quick relevant to the context of palliative emergency care. Transmission modes are more useful in different aspects of its application. Relation of medicine is very easy to drug transmission. It is very easy to apply the medicine, but not other method is any other mode of application. There are so many times of we have to repeat the medicine, and even after however the mode of application, we are repeating more and more. But in this method, there is no application of the medicine. Thank you. Thank you for the organizer of this webinar and to giving me the opportunity to present myself.
Thank you, Dr. Krishnamurari, for your nice case presentations. And you have demonstrated that homeopathic medicines transmitted through the hair is useful, and it can be even in the cases of the extreme emergency where the patient is not able to take the medicines. So with this, now since we are getting so much late, you remain in the room. We'll try to have some questions from the audience later on. Now I request Dr. Surendra Vikram Goswami.
Sir, I think Dr. Bipin have already joined. Dr. Bipin, please on your video.
I think we can start with Dr. Goswami because his topic, his presentation is very short, so he can do it within half an hour. So Dr. Surendra Vikram Goswami is a consultant homeopath from Jhansi and Uttar Pradesh with clinical experience of more than 15 years. He has done his BSc from Kanpur University and passed his BSMS from the Gazipur Homeopathic Medical College in 2000. He is now director at Ranjit Goswami Memorial Homeopathic Hospital and Drug Transmission Center Institute at Jhansi, and also president of Nidan Homeopathic Foundation, Jhansi, and successfully running 10-bedded homeopathic hospital at Jhansi. Member of the Society of Sahni Drug Transmission, Patna, and member of Cancer Institute of Homeopathy, Kolkata. He is also a regular visitor of the Navjivan Hospital, Pritampura, New Delhi, and RK Orthopedic Hospital, Parparganj in Delhi. He has also presented a case of cure paralysis at Liga International Conference 2011 and received Silver Jubilee Award for the Cancer Institute of Homeopathy at the Kolkata. So this young man, they are very much enthusiastic about the transmission of homeopathic medicines, and they are firm believer. And I request Dr. Surendra Vikram Goswami ji to start his presentations. Dr. Surendra Goswami ji.
Sir, your audio is off, Surendra sir.
Surendra ji, you start your audio. Your audio is off.
Yes, now it's audible. Sir, I just guide you screen share के लिए आप screen share try कर लीजिए वहीं ऊपर turn screen share on से.
स्क्रीन शेयर में ऑन कर दिया है रितिका जी.
सर आपकी स्क्रीन नहीं दिख रही है, आपको स्क्रीन शेयर ऑन करके विंडो खुलेगी, उस विंडो पे अंदर सेलेक्ट करना है योर एंटायर स्क्रीन को.
विंडो खुल गई है.
विंडो खुली है नहीं खुली है?
योर एंटायर स्क्रीन को सिलेक्ट किया,
अंदर क्लिक करिए, उस पे सेलेक्ट करिए, शेयर कर दीजिए. हाँ जी,
शेयर हो गया.
हाँ जी हो गया सर. अब अपना प्रेजेंटेशन खोल लीजिए सर.
एक मिनट. प्रेजेंटेशन खोल लिया है. इसके लिए आप मुझे सुन पा रहे हैं?
सर सुन पा रहे हैं, देख भी पा रहे हैं. आप खोलिए तो प्रेजेंटेशन आपका अभी ओपन नहीं हुआ है. प्रेजेंटेशन हो जाएगा तो मैं बता दूंगी आपको.
ठीक है. लोड हो रहा है.
जी सर लोड हो रहा है.
हो गया है.
फुल स्क्रीन कर लीजिए, फुल स्क्रीन स्लाइड शो ऑन कर लीजिए.
फुल स्क्रीन कर लें?
सर स्लाइड शो ऑन कर लीजिए नीचे से। थैंक यू सो मच।
आप इसको गुड आफ्टरनून एवरीवन, रिस्पेक्टेड सर डॉक्टर साहनी सर एंड डॉक्टर ओपी सिंह सर एंड चेयरपर्सन डॉक्टर एजाज सर. In my life, today is very big day. We present international webinar today. My case is paralysis, left-sided, which is wonderful result through by doing drug transmission. The patient is a Shivam Vanskar, age 22 year, male. The patient is come on in city Jhansi, UP. Next. Hello.
सर यू ऑडिबल एंड विजिबल। आप स्टार्ट करिए, कंटिन्यू करिए सर।
आपको सुनाई दे रहा है ना?
सर सुनाई भी दे रहा है, दिखाई भी दे रहा है, आप भी दिख रहे हो, प्रेजेंटेशन भी दिख रही है। आप स्टार्ट करिए, बोलते जाइए। कुछ प्रॉब्लम होगी तो मैं बोल दूंगी यहाँ से।
The present complaint is left-sided lower and upper limb paralysis. Now, element from fever after. The pain in shoulder joint, hip joint is movement due to paralysis. These all from last 15 days. Involuntary passing of stool and urine. This is from last 10 days. Okay. Now आप वीडियो दिखाइए. Please show first video in my screen. Hello.
प्रेजेंटेशन को ऑफ कर, यहाँ से प्रेजेंटेशन से बैक में जाइए, स्लाइड शो को ऑफ करिए एस्केप दबा के। हाँ जी, अब वीडियो खोल लीजिए। आपका पूरा स्क्रीन हमें दिख रहा है। आप जो स्क्रीन पे करोगे वो हमें दिखेगा सर। आप वीडियो जाएंगे, वीडियो ऑन कर लीजिए और फुल वॉल्यूम कर लीजिए अपने लैपटॉप का। यस सर।
This is the case. Only right-sided movement, but left-sided movement is not clear.
ये कब से हो गया? बोला हम तो दिखाओगे?
Only right hand and right leg is movement. And left to the lower limb and upper limb is not able to standing, not able to walking. Right. Complete left-sided paralysis. Now next, yes, left-sided paralysis. Next, doing case taking properly in homeopathy. Now past history, the history of pneumonia and past history in present tuberculosis 4 years in back. The patient is unmarried. Next. Next. Now family history is a very important. Hello.
सर आप यस सर। सर फुल स्क्रीन कर दीजिए।
कर रहे हैं. क्लियर हो रहा है? हाँ, नो फैमिली हिस्ट्री, ग्रैंडफादर इज पैरालिसिस एंड ग्रैंडमदर hypertension, mother diabetes, father paralyzed, and uncle tuberculosis. Mama, sister, mama has diabetes, sister has asthma, sister is expired. Now this is the very element from expired sister. Now we case taking in repertory we use radar opus. Now this is the chart, full screen. Element from death of loved one. His sister death, and after sister death is very soft. Now first symptom we create element from death of loved one, fear unknown of the patient is so sentimental, weeping easily, and symptom is taken convulsions element during fever after, and general paralysis. Now this is the cause, fever after, an element from death of loved one. Now medicine is selected Lycopodium 0/1 and transmitted through hair. Then after we have 10-bedded homeopathic hospital, and after 1 hour Lycopodium given through hair, and after 1 hour, now this is the result. Yes. After 1 hour, now only hand is movement. This is but lower hand is not movement, but left hand is movement. Now this is the Haring's law of pure seeing, because Haring's tells first upward to downward is present. Now third, after 10 days, and after 10 days, now patient come in my clinic. Now this is this movement. Next, and finally,
कोई तकलीफ सर में दर्द आता ना गले में, हाथ पाँव बढ़िया से उठ रहे हैं, कोई दिक्कत नहीं, पैर खड़े हो, आप चलते हैं।
This is the miracle of the homeopathy, and this is the miracle in drug transmission therapy. Thanks.
Thank you. Wonderful case you have presented, Dr. Goswami. And I hope and bless you all so that you can get many more such miracles in your life. Only thing that we all have to work purposely for the benefit of the humanity. And this will be the richest tribute to be made to any of the discoverer or any of the followers. So thank you, Dr. Goswami, Surendra ji, and I wish you a very long life, and my blessings are all with you. Now we come to our speaker, Dr. Bipin Jain ji. Sorry, sir, we have been late today, but anyway, the things are getting better. Now you are Dr. Bipin Jain ji is the principal at and the director of the academic services at M.L. Thawle Medical Homeopathic Institute. He's the approved guy. He's for the PhD also, and he has done his so many presentations are there. Recently, we had listened him at Darjeeling, where he presented a beautiful case. Today, he has come up with a new dimensions of the Materia Medica, and this is going to be a very useful understanding for all of us. So I request you all to have a patience here, listening to Dr. Bipin Jain ji. He has the distinction of working directly under Dr. Thawle sir, and the lizards and the legend of the homeopath. So with this, I request Dr. Bipin Jain ji to start your presentations.
Good afternoon, sir, and all the respected chairman, moderator, and all the participants. Sorry for delay, and there were a lot of technical glitch. Dr. Arora, can I have my own screen this?
If you feel fine, I've already uploaded your presentation. If you want to see this, then also it's fine.
No, then I can do the next.
Yes, you can see on the screen itself. There is a next option below.
Yeah, okay. Then there is no problem. Okay.
Yes, sir.
Okay.
Yes, sir.
Okay.
Thank you.
So, good afternoon, and we are going to deal with one of the very interesting and important perspective for our future learning of homeopathic Materia Medica. This is a phenomenological study of the mind in homeopathic Materia Medica. This is an unique contribution which Dr. Roberts has given to us, and we could not explore for so long. And it has started of late that we are now started studying the Materia Medica from these perspectives. The perspectives was always there, but giving it in a proper scientific structure and coming out with the proper image is something which is challenging and which we all need to get in for our future outcome of quality Materia Medica study. So the objective of this presentation will be to comprehend what is the concept of phenomenology, how it is applied in a homeopathic practice, how we learn to build an homeopathic Materia Medica image, and what are the approaches which we can follow so that from our day-to-day practice we can comprehend this over a period of time. It's a challenging task, but we all need to get into this so that we are able to create a quality Materia Medica images through these approach. I comprehended this concept by principle of art and cure by homeopathy by H.A. Robert. I mean, we all have read that phenomenological perspective from H.A. Roberts' book, but it takes a length to understand what is his perspective and understand the application to homeopathic practice. I mean, I would request that all of you must read that chapter again and understand that what level of quality additions he want all of us to do with our homeopathic practice and understand homeopathic from those perspectives. Then our master, Dr. M.L. Thawle, our founder, who has worked on this approach and has written a lot of literature in our ICR symposium volume on Hahnemannian totality. And there are certain ideas and concepts which I have comprehended from a PowerPoint by Custon KZ from Anna Arundel Community College. I mean, there are concepts which I took which are applicable for our study of homeopathic Materia Medica. So let's understand what is phenomena. Phenomena is a fact or a situation that is observed to exist or happen. A remarkable person or thing which when we talk of he's a phenomenal person or he's a phenomenon. But primarily what we are concerned with is a fact or a situation that is observed to exist or happen. So study of these phenomena is called a phenomenology. So we will understand how we can study this phenomenology. This is an interesting para which I picked up from H.A. Roberts' book. and he quoted Oliver L. Rezer, the associate professor of philosophy from University of Pittsburgh, and it is 1935 quotation, that integrating the vast and unwieldy masses of facts like what we have in our provers or in many of our cases of the science into meaningful whole, how to derive meaning out of those facts, the adoption of a phenomenological point of view is recommended. So he has recommended, if you want to understand and give a meaning to all the facts which we collect by proving our medicines or by our clinical experiences, we must follow the phenomenological viewpoint. So by phenomenology is meant a study of that which exhibit or display itself. It is a descriptive point of view obtained by viewing the things as a whole. So by this we understand it is a study of a experience. I mean, I will put it in a very simple way, as described by a patient, and integrating them and viewing thing as a whole. So we will understand how this is being done. Now there are certain perspective when we look at from a homeopathic Materia Medica perspective. So I mean, it's an interesting quotation from Carl Dunham. While Materia Medica in the book is a simple record of observed facts, but in the mind of practitioner, it becomes a subject of reflection. So how we pick up those facts, how we compare those facts, how we reason out those facts, which will be directly proportional to my natural ability, means the physician's own natural ability and his intellectual culture. So I mean, understanding a Materia Medica not only involve what is being written in a book, it also involves the subjective perspective and subjective ability of a practitioner to comprehend. Now this is a challenge when we are looking at the part of phenomenology. So and homeopathic Materia Medica is record book of effect of drug on human being, and it is based on drug proving. So now these are the perspectives. So let's understand, these are the two parallel things. One is from source book you develop the whole image, and from one is from the patient, and then we integrate. So let's understand how we approach to study phenomenology. Friend, this is going to be a little a difficult perspective for all of us, but it is very easy from another perspective when we look at from our experiences and put them into a proper perspective. And those perspectives which we follow every day is causation. What is the cause of something, some phenomena, how it has started, how further it has evolved, what impact it had on a different areas, and what are the parallel phenomena which are going on with this. So let's understand and pick up through case. This is a 35 years old lady who is a teacher and was a graduate. She's married since 12 years. Husband is in Kuwait and doing job there. She's a Roman Catholic, with father with 65 years and mother 60 years. Has got 3 brothers and 2 sisters. She came with the complaint of indigestion and burning since 6 years. And she had done a herniatomy and elements from tension. There was an ongoing stress which she experiences, and it aggravates between 2 meals. And when the complaint happens, she becomes restless, uneasy, and irritable. Same time, she has got griping pain, a history of nausea and vomiting, and loose motions, which are frequently happening due to pungent food. Which is better with Digene, ice cube, rest, passing stool, and from outside food, it all gets aggravated. She is an obese lady with black discoloration, boil heat, with smelling axillary perspiration, with acidity, with aversion to milk, salty and sweet, and craving vegetables. Her menstrual history is regular with 4 days dark red blood. She had some before heel pain and hypogastric pain before the period. During period, her varicose veins gets a little more swelled. She gets leukorrhea, which is profuse and watery. She has 3 gravida, 2 para, one natural abortion done 1 year back. One pregnancy where was a molar abscess and she was depressed, and in second pregnancy she was having a low BP. With the family history of mother arthritis and a heart problem, and father operated for kidney stone, and there was some leg problem which she was not able to communicate. She herself operated for appendix at the age of 13. She gets leukorrhea problem was off and on. She had acidity problem in the past which has recurred in last 6 months. She had severe dental problem during pregnancy. She had hernia after second delivery which was operated, and she had fallen down and fractured leg twice, and she has a problem with the reading with the right eye problem which she is now exploring. The history goes that she was born in a family, and the time of the birth, the same day it was raining and the father lost the job. Now, father blamed the patient as a bad omen and blamed her, and he rejected the patient completely. Now, this rejection of father continued during her childhood, and they were at Kuwait, and the mothers or the grandmother was at Goa. So father was never directly communicated with the patient. He was always angry on her, and in the process he used to send patient back home at Goa, where she was staying with the grandmother. And there was an aunt who used to instigate the grandmother against the patient. So patient had gone through the rejection and the neglect from early childhood, or I would say from the birth, and she continued to experience that. Father had a habit of drinking and beating siblings. Now patient used to save all the siblings and used to take beating on behalf of the siblings, but none of the siblings cared for her. Now this is a very interesting, you go on taking the beating one day after the another, and your siblings are hardly care for you. They never used to share the gifts which their father used to just bring it for them and not for the patient. Now this was very clearly available to the patient, but patient used to go out of way to protect them, to help them, to take the beating, and was trying to get into a good book of father. So neglected by a father, she got vexed because of paternal aunt used to instigate grandmother. Sibling had no affections. She took beating for them, so she had to suppress all her emotions, and which were resulted into the recurrent skin complaints and leukorrhea. She went through an early insecurity and forsaken feeling. So early she learned to take responsibilities. She completed her studies by her own, and she started catering. Now the only outlet she could have was going out, and she chose that. She started catering to unprivileged slum children. She started teaching them. She started preparing them, and she proudly said that those students remember me. Now that was her channelization of the outside world, but her internal pain and agony continues with the behavior of father, siblings, and mother had no say, but she also never came forward to protect her. Only thing is, grandmother had a little different role. When she was instigated by a paternal aunt, she used to get angry. Otherwise, she was the only support structure which patient had. Now, marriage was due to the emotional blackmail which mother did, and she said that if you don't do the marriage, she will be thrown out. So she went ahead and did the marriage. Now the problem continued and continued at her husband's place. Immediately after marriage, husband lost the job, and the same thing happened. The mother-in-law and sister-in-law, they started taunting patient as अपशकुनी और the person who जिसके पैर अच्छे नहीं है, but both the times the father, even the mother-in-law and sister-in-law, forgot that immediately after the husband got a better job than the previous job, but that was not taken. So forsaken feeling, void of love continue. She became affectionate, religious. She started teaching in slums, so sensitive to suffering. She suffered from headache and acidity. She wanted love, care, and appreciation, so she went out of way and started helping them. And she started even helping mother-in-law and sister-in-law. Husband was abroad. She was worried about husband's health, so she never used to complain about her plight, and she was not wanting to trouble him. So she was not sharing her problem. She was feeling lonely. There was no support structure, but she continued and continued to serve mother-in-law who was not well. So she was the only one who looked after her. Now she went on supplying, and she felt that the people are not giving back to her. After some time, the patient's father realized it, so he wanted to meet her, but patient had a fear that what if he starts behaving in the same way. So she wanted somebody, but there was nobody available. The sense of unfortunate crept in, but what was important is her tolerance and continuous ability to supply. So that continued in spite of being lonely. Husband is not there, mother-in-law and sister-in-laws. So her ability to sustain, ability to function continued. She is very attached and over anxious about children. She is anxious about mother-in-law's health. She went and did the confession in a church, and she has probably forgiven everybody, but she had an reservation about meeting the father. She has a dreams of dead bodies. She had dreams. Now look at her subconscious mind. Parents took her back and they are loving her, and husband is with her. Now these are the types of dreams, and these are the desires which she repressed. And to get that love and the care, she went on supplying and suffering at a physical level. So now what has happened is she was neglected, forsaken, vexed. She suppressed her emotions, but she went on overdoing. In a process, she thought that she will get the love, care, and appreciation, but she never got it. So she went into dissatisfaction. So we again supplied it, and the whole cycle continued. But what was important is her emotional sustenance of supply and her breaking down of her physical complaints. So void of love, yearning for love and recognition, the internal demand unfulfilled, she chose to supply to others, dissatisfaction, repression, and this cycle continued. So this took us to magnesium in her case. Now this is a whole cycle which we could see. Now we had seen the patient evolving from a childhood to an adolescence, the marriage, the post-marriage, and the current state. The patient's own state of causations, the early genesis of those forsaken feelings, then the evolution through which those feelings continued, and she went on supplying, and now the current state where the functioning continues with supply, and her dissatisfactions which is there inside went repressed. She suffered at a physical level and also at the mind level. Now this is how you understand the whole event and whole phenomena this patient went through. Now when we look at the interview, now the interview was taken by a physician who agreed to what patient shared. That means the state and the subjective perspective of physician of suffering of the patient and the patient's own suffering, they came inside, and this is how, from where this whole life sketch has got built up. And there was no attempt by a physician to get out and understand objectively that why the people behaved the way they behaved. We continue to agree to what patient said. Now this is so then this document, what we are seeing is a combined effort of an interview, of a phenomena between patient and a physician. So now let's see what is phenomenology. It is in philosophy, the use of the word phenomenon differ from other uses in that it refers to perceived event. Now these are so many events which we perceived, may be perceived through person's senses or with their mind. So it is being perceived through patient's mind and physician's mind and senses. This terminology originated by philosopher Husserl, Stuz and Ponty. This is a framework for providing a qualitative understanding of human experience. Now this was an experience which patient went through. Now we have tried to qualitatively understand this experience, and next stage to focus on what meaning we are giving it to. So we have tried to give a meaning to this experience of which she went through, and what are the perspectives and what she did is a cycle. But one thing which we failed to explore was whether what she was supplying is what the people needed. So what is the meaning of experience? The process of getting knowledge or skill from doing, seeing or feeling things. So what is an essential meaning of the experience? It is that which it is and without which it could not be. It's an interesting definition. Now what is an example? What is the essence of being mother? When you ask plenty of females what is a mother, what is an essence of being mother, and you put down their experiences, and then you will understand that if those aspects are there, then it is an essence of being mother. So again, now the another example is what is an essential structure of a caring nurse-client interaction. So now what we are doing, we are collecting those experiences, trying to integrate them and understand those experiences, and then give meaning to those experiences. And this is what happens when we interact with the patient's life history. And if you interact with number of life histories with the same medicine, I mean, we will be able to understand what is the possible different areas and their experience of those patients, which is connected with the same cause. From one perspective is a remedy, and from other perspective is the causations which we are now talking about. So all patients who receives magnesium, whether their experience is the same, similar, in what areas, with whom, what are the causations, what is the evolution, what are the expressions. Now this is the study of this whole phenomena is called phenomenology. So what does a physician want? Physician wants to understand human experience. The goal is to understand an universal meaning of an experience. And when we reduce that context specific information to a more general understanding of phenomena, then that study is a phenomenology. Like now we have seen in one case how we have derived magnesium. Whether the similar things and similar experiences we can experience through number of magnesium cases, and if we are able to context specific information and we are able to generalize them, then probably we'll be able to understand what is a phenomenological study of Materia Medica. So what is the final goal? That's what I said, to produce a brief statement that will inform us about what is this phenomena is all about. So phenomenologists assume that the human experience is inherently subjective. Now all the experiences which patient shares us, what we receive, are subjective, and that is why the aphorism number 6 of unprejudiced observations and the perspective of at what level one should collect the information, the framework, is both very, very important for us to reduce subjectivity. But primarily all experiences will definitely have the subjective touch. Within this subjective experience are essential structure. So when we are understanding these subjective experiences from the patient, there is a structure through which the patient shares and we understand. Now this structure can be their experience sharing of a different stages or the different level or a different types. So the way to gain access this structure is through description. So when we write life space, we are putting down the description, or we can record the interview and we put down the whole description of those interviews, and then we start analyzing those interviews. So physician chooses the phenomena and select appropriate model. So we want a model on which we will collect the information. So our case taking model or a data collection framework, which we all have. So we choose the patient, we choose the framework, we interview the patient, and we put down the experience of patient. We also put down the what experience we went through. And once those experiences are put down, we reduce and we abstract. Now, like here, we abstract the perspective of causations from the perspective of a forsaken feeling. Then the other theme was what are the functioning and how she functioned. Then third thing was what are the sufferings she went through, and then what are the final culminations in terms of effect. Now these were the themes which are reduced to, and we could finally create a statement out of that one experience, and then we give it back. Now we cannot give it back to the patient, but we can give it back to the different participant or an observer and validate these findings. And in this, the physician's own experiences are also there, because you cannot have a description of patient without we putting in our experience. And since the outcome is part of physician, patient, and observer, it brings in a central area where all the three overlaps, and that is the primary essence of the whole experience. So what is the characteristic of phenomenology? Use of subjective data to describe an objective truth. We have used the subjective data of the patient, physician, observer of a patient to describe an objective truth, like why patient is suffering, what patient did, and what are the outcomes. Physician's own experience needs to be integrated, and finding the common thread. So what is a common thread? Now we have only dealt with one experience. If you go on dealing with multiple experience of magnesium, you will find a common thread. So we need to have this primarily framework of homeopathic philosophy, have to create a framework so that we are able to interact with the patient in an integrated, balanced way, which will take us to totality. And when number of totality is integrated, probably we'll be able to create a thematic Materia Medica or phenomenological based Materia Medica. So what are the core part? One is we must be conscious about the causation, because each phenomena in nature got an invariable set of antecedents. So every cause will have expression, and every expression may be a cause. So we must track down all the causes of that phenomena. And we also, and from homeopathic perspective, now these causations can be predisposition, precipitating and exciting causes, maintaining and modifying causes, and the concomitant. So each of these cause effect will have coexistent, correlational association symptoms and the expressions. So once we combine both of these in a individual phenomena, we are able to construct a whole image of Materia Medica based on phenomenological study. So we explore from birth to death, from causation to expressions with concomitant, from predisposition, disposition, diathesis to disease, and expression at the mind and body, and create number of themes related with that particular remedy through number of cases. Then probably we'll be able to do a quality phenomenological study of Materia Medica. I hope things are getting clear. If any issues, you can put me a chat box so that I can answer them. It's a little difficult subject, because this is also a part of qualitative research which we must explore at our maybe an PG level or a PhD level to derive the phenomenological study of mind, which we are now working in today in a homeopathic Materia Medica. Sir, I can take any questions till date or go ahead. Hello? Hello?
Sir, yes, sir.
Can I go ahead, or if there are any questions or anything?
No, sir, you can go ahead. No questions yet.
Acha. Okay, no problem. So let's see the second case. This is a 37 years old male who is 8th fail, married since 7 years, has got 3 brothers, and he reports to our OPD. Now look at the type of pathology he has. Very bad tortuosity, distended veins with huge bulging, pain, pulling, stitching, with pulling and stitching sensations, with the discolorations, and everything started in 10 years and gradually progressive. He's getting pain while walking, standing prolonged, better by sitting and better by lying down. These are the classical modalities of varicose veins, but the intensity is quite high at age of 37. Now, what is another complaint? Now, the patient has got biliary system problem with a bile stone, gallbladder stone, with the feeling of getting something stuck, with a burning pain and eructations, with midnight aggravation, with fried food aggravation, prolonged sitting, and feeling of heat all over the body. And he has some sebaceous glands, so sebaceous cyst, and also has got renal stone. With the increased frequency, has to rush soon after drinking water, frequency 3 marks. And we can see again this patient has got excessive body odor from perspiration, with the craving sweet, meat and fried, urging frequent and unsatisfactory stool. Desires are suppressed because he stays away from the wife, and plenty of unremembered dreams. Hemorrhoids since 17 years back and operated, lumbago, hepatitis 3 years back, and hydronephrosis because of the obstructed renal stone. BP was normal. I would say the USG pelvis, 29 millimeter gallbladder calculus with the right renal hydronephrosis, with upper tooth or hydroureter, with cystitis, and the Doppler of the lower limb talks of incompetent medial third perforator. Now the history of this person. This person had a joint family. Father was the eldermost. He was earning well, and he was able to feed the whole family. There was a dispute in a family where the all uncles and father got separated in a business. But uncle cheated the father, and they used to sell all their fish to the market on the name of the father. And by the time father used to go, because he was alone, all the fishes were being sold off, and the family had to face lot of financial burden and the stress, and the conflict between the family took to the major plight for the children, because their 2 times food also got compromised. So patient felt extremely sad, and he was feeling very bad for the father and the condition of the family, and he used to weep alone. So what happened was, the patient by himself started working on a relative's farm at the age of 8 to 9 years, since he was not interested and he was pained by the family's financial status. But one thing was very clear in his mind, that father was not that much loving and caring as far as he was concerned. So to see father relaxed and happy, he started working. Now that was the first effort he did to make father happy. he continued to work in the field. At 17 years of age, with the suggestion of one of the relative, he shifted to P, and he worked on machine in company, and he earned 500 rupees, and he used to send it to home. Now what did he do? He tried to go out of way, and he skipped his meal. He tried to make food himself. He ate food outside, which is cheaper, and he, with the continuous hard work, there was a lack of water intake, and he suffered from hemorrhoids at that time. He used to send all the money back home because he thought that this will make father happy and make family comfortable. So ease out responsibilities. After 10 months, he went back to meet father. And one day during dinner, a patient told his brother that you better concentrate on your studies and not spend time otherwise. We will look after all of your needs. Father got angry on patient because he did not like the way patient told to the brothers. He said to brother that I am alive and to look after all this. You should not say this in these matters, as they are not living on your money. And this again disappointed the patient very badly, and he decided he will not say anything from now, being elder son of the family. He used to weep, think a lot. Till 10 years he worked at P and went back after that, as he suffered from severe lumbar pain. He always gave his maximum salary to family, to father, for their betterment, as he wanted some recognition and some appreciation from father. He never made a friend at P because he thought that having a friendship, he will have to spend a lot of money to maintain it. Only purpose was to work hard, send it back to the father and get his appreciation. He only used to work and sleep, no other activity. He never wasted any money. When he went back at village with lumbago, father did not support him much. Father feels that patient never supported family. Now this is an interesting thing. Patient feels that he supports the family, and father feels that he never supported the family. Patient stayed with the aunt. Aunt persuaded him to get married to a very educated lady who was working. Patient first tried to refuse it, saying that he will spoil the life of that lady who is so educated, and he was not ready to do it. But then that lady was ready to marry patient, so they got married. Now this is an interesting perspective, that patient goes out of way when somebody is ready to get that appreciation, that he is so accommodative, so have got a good perspective, and he is ready to give away things. And now this quality of his temperament continued, and he continued to give support and help to patient's family, to father. So next thing what happened was, father wanted to buy a property, so he approached patient for money. Patient asked him that I will give money, but you do it on my name. But father, after receiving money, he took property on his own name and told him that there was some problem, that is why he took. But patient never, when patient was very unhappy, but he never spoke back to father on this matter. He was very disappointed, that struggles to make his father realize his effort, but he is unable to get that effort from father. He misses his son and wife who are staying away. They are in Kolkata. Wife is working and having a good salary. And with all this suffering, he went through so much of physical illnesses, but he's still wanting to give to family, to father, to wife and wants to work for happiness of all others. And he gradually now he started feeling that he will die soon with so many complaints, but he wants to live long to improve his own family's status. So now again, with the forsaken feeling, with the lack of love and care, patient was the wanting to get that recognition from father. So he went on out of way of doing and overdoing the process, but in the process he never got it. And all those feelings when retained, he suffered from gallbladder stone, renal stone, and varicose veins. The patient was prescribed Magmu 200 1 powder weekly. In between few infrequent doses of Thuja. He was under treatment from June 2019 till today. All his complaints, the mood, the disturbed sleep, his eructations, his varicosities, everything improved, and his frequency of the motions, his frequency of urine, all have improved. He passed one stone. And his gallbladder stone, which was 32 mm to start with, became 25 mm and 13 mm as of last sonography, which was done on 11/5/2020. And he passed. This is a renal stone size, which is almost maybe an 7 mm stone, which he passed and which he brought us to show us in a month of January. So what is again, we are now seeing on magnesium with the neglect, forsaken, vexed feeling, suppressed emotions, overdoing. He go on supplying, he demands love, care, not getting, dissatisfaction. He further do it in a hope that he will receive love, care on some day. So this is again a magnesium. So we are now seeing, both the cases developing a similar theme of void of love, yearning for love and recognition demand, which is internal, unfulfilled, choose to supply to others, but supply what she thinks will bring the love and care, and is not very conscious and sensitive to that probably the other person is not concerned. So she doesn't get the things back, the appreciation for which she does. She gets into dissatisfied state, and then everything repression. So either suffer from mind and body, or his dreams or her dreams, which have reflected their internal mental state. So now we are seeing the two parallel magnesium cases. Now what we have seen again in a second case, the physician who explored went on subjectively feeling the pain of the patient. But both the cases brings the question about why somebody should behave the way patient feels. So is the patient not able to receive the love, care from others because probably they are not in the form in which the patient wants? We are not even able to explore what are the further actions which to take. So here the physician and patient both went through the same experience as well as observer. So we have got both the documents with their descriptions, in which the theme of causations in terms of neglect, in terms of early genesis, in terms of overdoing, and in terms of suffering. And there is a definite perspective of all those, that how individual cope and adapt to these state of feeling. Now this is a short case which will further explain. This is a 78 years old retired car driver who is a Christian. His father is expired, two brothers are expired. Patient was admitted under general surgery with the right grade 2 amputation done by surgeon. This was the state after amputation. After few days again gangrene started. So referred to orthopedic surgeon, he did debridement, but again gangrene started. So 15th, within 8 days, the slough and bone, you can see the state, the bad state, which is not healing. Advice below knee amputations in view of increased sugar level. Patient is a highly diabetic. So what were the case we have now in our hand? So we have swelling with the ulcers, with no pain, with serous offensive discharge, with the elevated sugar, and the loss of sensation, with the pain which is throbbing beyond amputation. There's a touch and aggravation movement of ankle. Now he had a past history of hypertension, which was treated with antihypertensive. He has flexor deformities, so there are possibilities of osteoarthritis, with a general perspiration all over, with the hunger aggravation, craving chicken and curd rice. Based on the local symptoms, we prescribed carbo animalis. After carbo animalis in 15 days, there was some aspect of healing and the offensiveness reduced. Again, after a few days, there were some granulation tissues which were appearing, but there was no further improvement. So we decided to take a complete case, and 2 people were involved, the physician and one of the observer, and we got 2 versions. Primarily, I would put the 2 perspective of looking at the patient. The physician, who is a male, could see a father figure in a patient. He was impressed by a patient, how he has struggled, done hard work, whatever small life space we got from the patient, and come up with the life. They were not able to explore much about the early life, and the post life, he did lot of the post coming to Mumbai. He did lot of hard work, and he was running a taxi. He has got 3 sons, out of which 2 are separated. 1 son is with him. He got his daughter married, but there was some problem at daughter's side, so daughter and brother-in-law, son-in-law stays with him. He did not go much into detail. He was not ready to give what happened further. Wife, he was in a great relationship with wife, and she was the only support which he could gather in his life. And the wife died sometimes back, and after that he was shattered. Now he is trying to get back to the life. He want to get mixed with the people, want communication, but now he is not able to work, so he is at home. So from all this suffering, the male physician was very impressed that how this man has built up his life and focused on positive aspects, while the female observer had all the sympathies that at this age, how is he managing himself alone, suffering. So she was more sympathized with the physician's, with the patient's current suffering. Now we had very scanty data. Now how to understand the patient. So this is male and the female combinations, perceiving the unsaid and unknown. Now this is where we need to understand happening during the interview. So what actions which patient did, which were pointing to certain themes. From observer says that patient avoids quarrels. That means he wants peace. He gets palpitations when he sees people quarreling. Even if somebody hits him, he thinks that it may have been his fault. Now understand how he thinks and keeps quiet about it. Says that when you talk, your talk is good, people remember you. Now see the way through his behavior, he want appreciation, he want recognition from the people. And at the end of interview, with the folded hand, he apologized with the physician and observer and said, if I have done any mistake in communication, please forgive me. Now this is the way in which patient deals with the life. Now this is one of the phenomena which happened during interview. Now this is the same common thing from the physicians, that he fears quarrel, he doesn't use bad words or expresses his anger. He will give rise to quarrel, and people may harm him, hit him, and what people think about him. At the end of interview, he said that he always uses good and never bad words, also expecting same things from everyone. He repeatedly told sorry to PP, if there is any mistake while talking, as he is a illiterate person, for many questions he answers quickly, telling that he doesn't know or doesn't remember, but he tries to, communicate some detail afterwards. Now this is a peculiar behavior of giving, of asking sorry, getting appreciation, getting recognition, without he disclosing all the plight of otherwise life, about sons, about daughter, about other son who is unmarried. So probably all those experience and expressions may be conscious, may be suppressed, or may be repressed. So repressed emotions, unknown to his own difficulties. So only available thing is a hardworking quality with display of being good to everybody. And all this to gain the recognition and care and desired. So this patient was given magnesium with diabetes, gangrene, old age, with endocrine system, and a repression and a lack of emotions with want of appreciation. So now you can see this was 7th March, and gradually the whole thing went on healing. These are the last pictures which you can see, and this only happened with Megha. Now this also talks of the way we deal with our internal things and the way we deal with our own pain. Now this was the wound healed because magnesium healed inside. Those wounds were open but painless. Now he had got painless wound because he was not conscious of the pain which he was going through. Now this is again a magnesium which we can see all the 3 cases. Now let's brief few commentators how they have seen. When Kant said illegitimate infants conceived from clandestine relations, orphan children. Now is the orphan means that child does not have mother? No, orphan means that you do not get the love, care of a mother or a parent or the people who take care of you. That is orphan. Orphan is a concept. It's not a reality alone. Now, what Vidulka says that magnesiums are peacemaker. Now, you have seen in all our cases also. So, the same theme of peacemaker. Suppressed own emotions, they have got lot of sense of duties and anxieties, but central thing is peacemaker. Whitman also wants, very interesting part is tendency of walling off, quiet and composed. But he also talks of at the end when they are, pushed, there are possibility of outburst, which we have not seen in our cases, but we need to explore this. Now here also, if you look at the Sholton, there is a pacifism, to be accepted, to be loved. And for that he is passive to get it, but he goes on giving, supplying. And there are times when there is an aggression to be recognized, to define borders and outbursts. So feeling neglect and this pattern of developing own self-worth and developing love, getting love, the processes which even these commentators talks of comes very close to what experience we had from all the 3 cases. So now we have got so many experience with the insight of these commentators. So we can understand how thematically or phenomenologically we understand the evolution of magnesium. So rooted most primitive repressions. So what is a primary cause? Is a child without primary care, orphan, single parent, adopted, working parent, daycare center, creche, or the rejection by, or since rejects his parents and they reject him. So he goes through inferiority complex, he withdraws, he is not able to communicate. So he resort to different channelization, like our first patient went and started working with those underprivileged children. So all those hostility, aggression is suppressed or repressed. So then he gradually become unaware about them, unfamiliar, and he seeks recognitions, he demands. But when he doesn't get, he weeps alone. He wants identity, he wants, and that recognition, so he go on performing, he become obedient, he become academic, he tries to excel. These are the ways you get recognition and appreciation. He tries to work in extracurricular activities. But all these, if there is any problem, they experience the anxiety. But only thing which is consistent is their effort and their sustenance. So they become teacher, painter, artist, singer, gurus. They are very faithful and sincere worker. They reach out to masses, but internally they are withdrawn. So sometimes they may get into unsuccessful, hopeless, and may go to suicide, which is at very, very late stage. So they have got ability to get out of these depressions. They give even more. When they marry, they expect spouse to supplement, the mother love. They develop strong bond with the conducive environment. They are able to sustain. With the non-conducive environment, they get into suffering. So what is the level of suffering? They may get into mental suffering, to schizophrenia, mania, or psychosis, and destroy themselves, or get into delusion, or all level of physical sufferings at a syphilitic level. So we have seen from a SORA to retention of psychosis, maybe some explosion in between of a tubercular, but finally the destruction, which is very, very late in magnesium. It's not like, aurum, or it's not like lachesis, and it's very late. They sustain, they manage, they maintain with the void of love, repressed desires, trying to be good, no reciprocation, and body and this. So this is how we have developed a theme through this phenomenological study. But is the phenomenology only applied to the mind? No. There are a lot of phenomena which are observed in physics, in chemistry, in physiology. So at what level you can see phenomena? In physics, chemistry, mathematics, evolutionary biology, how the biological structures and functions evolved, how psyche is evolved, how pathology is evolved, how psychopathology is evolved, how miasm is evolved, and how individual disease is evolved, and how evolutionary homeopathic pathology is evolved when patient and environment interact with each other, and we notify and describe all these experience. In this presentation, we have restricted to the level of mind. You can go and even understand the hypermagnesium, role of magnesium, intracellular, extracellular, and connect with your evolving themes and phenomenological study of Materia Medica. So I'll give you brief understanding of it's the second lightest alkali, ranked 4th in overall body. It is stabilized, 3rd most abundant element dissolved in seawater. So it's such an important part of our body. It is 50% of total amount in bone, 45% of muscles and nerve, 5% in extracellular fluid, and 2. So it is an integral part of functioning at all the levels. Function of magnesium is active energy production. I mean, it is energy production. So that is why you can see the amount of continuous activity the magnesium is able to perform, sustain it, and it does it through insulin utilization and carbohydrate metabolism. It is catalyst, that is, it is trying to give on speed to various reactions in the body, and it is helpful to also, even at the mind level, you see the patient is helpful. He tries to bring the peace and continue. It developed a strength or a structure, so through protein synthesis. With the calcium homeostasis and PTH, he trying to be a structure of a bone and muscles. So it is an important part, plays an important part at plenty of level of not only mind, at the body. So this is one of the deep acting constitutional remedies. in all four miasms. Central core of this is mind. This is required for energy generations and distributions, which is very, very basic for survival. The love is the force which binds life together, but their early experience of love lake triggers the whole phenomena which builds their life around the hunger, or I would say the appreciation or the required love they need from the people around. Magnesium has got very high melting point, so they have got heat resistance, so they are very resistant to deeper stressor of life. They are strength to the character and the human disposition. You have seen how our people have sustained all the three patients, and the type of image our commentators also have said. They are very frustrated and unhappy person, but they present a very placid front as if nothing is happening inside. And this all starts with the rejection of the parents, which can be as early as mother's womb, and hypersensitivity. The primary adapting, how they adapt to the life, is by repressions, by dream. They have deep negative energy, but with a very, very positive energy looks. Smile on the face, but suffering from inside is a central idea. So phenomenological study needs, integration of internal and external environment of a patient, prover, physician, and observer. Now all these interactions, they produce experience. Now this experience, when put into the description, will give you the theme of those remedies. And once we create those theme and put into the structure and evolutionary content, we understand the totality of that perspective remedy, which built a patient's totality and homeopathic Materia Medica. So what is the phenomenological study of Materia Medica? All the experience needs to be documented, including of the patient, physician, and observer. These experiences need to be categorized based on document and the framework. Common themes needs to be extracted. All the common themes, when connected logically, will be evolutionary study of homeopathic Materia Medica, which emerges out of life experiences. So we are giving meaning to those experiences, generalizing them, integrating them, and making a live image of a remedy in a evolutionary fashion. So this is, in nutshell, is a phenomenological study of Materia Medica. I am really thankful to the organizing team and Dr. Sahni sir for inviting me for this presentation. The work input put by the Department of Materia Medica of my ML Memorial Homeopathic Institute. All the patients who make their experience available to us for our learning, and all the observers who participate in learning through experience, including our students, our faculty, and our teacher. Thank you, sir.
Thank you, Bipin ji. Such a wonderful presentations. You have definitely shown us a new path for us, and I hope the students will understand and learn. This is a learning opportunity, and this Dowley Institutes is always very promotive for the educational background, and I am very much inspired with such a phenomenon of these things they are here. So with these things, now we are moving to our next speaker, and she is Megha Lawyer, and I hope we can have another session now. So Megha Lawyer is here now. I think
yes.
Some light problem.
Yes. Mic is sir, ma'am, I request you to please on your light. I think there is some issue with your
light problem, Megha.
Light or camera. Yes.
So I think the light has gone.
Okay, so it's all right, ma'am. You can turn off your. Yeah, now it's fine.
So,
absolutely.
Make your audio on.
Yes, my audio is on. Can you hear me?
Yes.
Hello.
Megha Lawyer has come.
Yes.
Now, just a brief introductions about her. Megha Lawyer has completed her BHMS from the most premier institutions, National Institute of Homeopathy, Kolkata, and she had completed her MD Home with the pediatric specialty from GD Memorial Homeopathic Medical College and Hospital. Earlier, she served as a medical officer under NRHM program in the state of Sikkim. She joined teaching profession and presently serving as associate professor in the Department of Obs and Gynae in GD Memorial Homeopathic Medical College and Hospital, Patna. Dr. Megha has served as a resource person to the medical officer serving in RBSK program under Bihar state government, and several articles are published in the homeopathic journal. Megha is happily married to Dr. Sahni, and she is actively involved with the Homeopathic Science Congress. So now I request Megha to start her presentations.
Good afternoon, everybody. I'm here to present, I'm Dr. Megha, here to present the presentation on the discovery of Dr. B. Sahni. And I'm very glad to present this presentation and feel very proud here to start with the presentation. So I here directly start the presentation. This is the discovery of Dr. B. Sahni. Homeopathic system of medicine is diagonally opposite to the conventional method. Sounds are coming. Homeopathy is based on the dynamic spiritual layer of life which governs the material body. Entire principle of homeopathy is on the dynamic life, dynamic disease and dynamic nature of medicine. Dr. Hellman discovered that this dynamic medicine can be prepared by reducing the material quantity of the medicinal substance and came up with the unique dynamization process of converting the material substance into the potential dynamic substance. Not a single molecule of the main substance are present in the homeopathic potency beyond 6 to 12 potency. Most natural question arises how this dynamic medicines, which is deprived of the material substance, can affect our body and bring change to produce cure from the diseases. No doubts that this highly potentized homeopathic medicine has been used and curative effects are observed since the last 200 years. Many plausible explanations are tried to be made, and still today it is being attempted. It is not yet confirmed how it works. 60 years back, Dr. B. Sahni made a valuable insight into this dynamic medicine. Dr. Sahni observed that dynamic substances are not material to be administered orally through mouth. All dynamic substances have the basic property of remote sensing. As such, homeopathic medicine also can be transmitted from a distance. In early 1960, Dr. B. Sahni started making experiments on this potentized medicine of homeopathy. Medicine Dr. Sahni used natural belonging of the patient as medium. Initial observation on getting affected simply by coming in direct contact as touch was also mentioned in organon of medicine, and olfaction were practiced which has proved to be quite effective as that of oral administration. Dr. B. Sahni continued his experiments on patients attending his clinic. It must be recalled that Dr. B. Sahni was well reputed for his classical approach to homeopathic medicine using single medicine only. Dr. Sahni was reputed for his firm belief in classical application of homeopathy. Repertorial approach of Dr. Sahni was very much appreciated as he had good command over the Kent's repertory. Patients from all over the country were taking consultation from him. Still today we hear many legendary cure from the people of his time. Dr. Sahni had deep insight into the subject of philosophy. It made him well versed with the organon of medicine and chronic disease of Dr. Hahnemann. Vast experience of clinical application of homeopathic medicine in incurable diseases with great success and deep insights into the homeopathic philosophy made Dr. B. Sahni confident to start making new experiments. Classical procedure of homeopathic practice. After long and detailed case-taking and final selection of the medicine through repertorial way was his way of practice. After making selection, he started transmitting selected medicine in potency through the hair taken out from the patient. This selected medicine was brought in contact with the hair. Patients were asked to report about the changes observed. The very first experiment proved to be a grand success. Encouraged with the result, he continued to experiment on different types of patients with continued success. Success with the first experimentation on patient. Researcher mind of Dr. B. Sahni could not get satisfied with this success as he wanted to make it a confirmed and evidence-based so that it can be utilized by all. He got his observation published in journals and books. His book Transmission of Homeo Drug Energy from a Distance was first published in 1970, which was sold out and again published his second revised edition. Dr. Sahni continued making innovation with constant follow-up with his research till the end of his life. Dr. B. Sahni discovered new mode of distant administration of dynamic nature contained in homeopathic medicines and observed that it can be administered from a distance as remote sensing attribute property in most natural outcome of thoughts with insight into the potentized homeopathic medicines. Penetrating capacity of the medicines are dependent on the nature of medicine as well as the place where it is tried to be administered. Material level needs material transfer mode. Mental level needs psychic mode. Dynamic level needs dynamic mode. Administration of dynamic medicines of diseased person has remained a subject of study for Dr. Hahnemann and all his followers. Every part of our body that possesses the sense of touch is also capable of receiving the influence of medicine and of propagating their power to all other parts. Aphorism 289. Homeopathic medicine or memory. Dynamic property and electromagnetic waves. Dynamic nature of medicines compels one to think of its remote administration. Today we are experiencing remote effect of dynamism in every field and walk of life. Today, science is venturing to explore the realm that has been foretold. In 1982, an experiment by a team of physicists in France has confirmed the idea of transcendence in quantum physics. The experiment conducted by Alain Respect and collaboration proved that two quantum particles emitted from the same source remain inextricably correlated. When a change is made to one particle, instantaneously the other particles is affected. Similarly, even separated by a vast distance. When there is no signal in space, it is time to meditate on their connection, where then exists the instantaneous connection between correlated quantum objects that is responsible for their signal-less action at distance. Signal-less action at the distance. Change made in one part have similar effect in other counterpart. Following assumptions are made to explain the process of transmission of homeo drug energy from a distance. Number one is the electromagnetic wave from the environment are incidents on medicine at infinite number of planes. Light. On medicine at infinite number of plane, and they are scattered at right angle to the direction of incidence. This is the Raman effects explained. This is the incidence ray and this is the reflecting surface. When the incidents fall on the reflective surface, the reflected rays carry the property of the reflecting surface. So reflected rays carry on the property of reflecting surface. This is the reflecting surface, the medicine with the hair of the patient. Whole range of electromagnetic wave are incidents on the file. This is the file containing homeopathic medicine and reflected along with the medicinal property. And it is reflected along with the medicinal property. The property of medicine is reflected through the reflecting surface. The scattered radiation have a different frequency from the incident radiation, and the difference in frequency between the above radiation is the characteristic of the medicine used, but is dependent of the incident radiation. So the characteristic of the radiation that is carried by the carried from the reflective area, it depends upon the incident radiation. The reflected electromagnetic wave assumes the frequency of hair and transmitted to the patient with forced vibration or sympathetic vibration. This is the hair inserted in the file containing in the homeopathic medicine, and the electromagnetic waves are transmitted to the patient. Patient hair or natural belonging, as soon as they come in the field of medicine, they attain the frequency of the scattered radiation, and simultaneously the patient kept at a distance also attain almost similar frequency due to forced vibration or sympathetic vibration. This is a Sahni effect. Whole range of the electromagnetic wave are incident on the transmission set. Hair assumes the frequency of the scattered beam and transmit the medicinal energy to the patient. Effect of distant administration of dynamic drugs are instant. So the effect that is caused by the transmission are instant. They have been demonstrated through the Kirlian photography. This is the photography that is taken to know the small particles, electrons are photographed with this technique, that is the Kirlian photography technique. Patients experiences the changes. Changes has been confirmed through the pathological report. Again, the pathological report states whether the patient is improving or it is stagnant or it is aggravating. That is all reported through the pathological reports. Now, what is the advantages of this is The transmission is, distance is no bar for treatment. Patients seated at faraway places can be treated. During aggravation, it can be brought under control by simply removing the hair from the medicine. So when you feel that when the patient says that the symptoms are aggravating, you can just remove the hair from the medicine. And the third point is, in case of wrong selection of the medicine, action can be stopped by, wrong selection is there, then medicinal action can be stopped by removing the hair. It is controlled mode of application of medicine. Only required dose is administered. Only the required dose is administered, and you can control it. Whenever there is aggravation, you can just remove the hair from the medicine. And when you feel that the medicine selected is not right, it is the wrong selection, then also you can stop the medication just by removing the hair. But it raises many questions, also thus giving scopes for many more researches in the field of dynamic medicine. Whenever there is a new invention or the discoveries, without the questions being raised by the opposition or the other people, the scope gets limited. So when there is more question, there is more researchers in that field, so there is more scope of its development. So there are many questions that is being asked again and again on the transmission. So that gives more opportunity for the researchers to make more improvement in the field of dynamic medicines. Measurement of electromagnetic wave of medicines in different potency will be a huge task. Similarly, by finding electromagnetic wave of individual patient will obviously revolutionize the selection of the medicine. So it is a vast task, it is a huge task to measure all the electromagnetic waves of the different medicines in different potencies, and also the electromagnetic wave of the frequency of this one, of the individual patient also. But if it is done, it will revolutionize the selection of the medicine. Recent development in Dr. Sahni concept of distance administration. This is the recent development that is being done on the concept of distance administration. It is an article of Dr. M.K. Sahni, which was published in Clinical and Experimental Homeopathy, ISSN 09749799, January 2020. The applied homeopathic drug transmission in the cases of hypothyroidism case study. So this is the development, the recent development in this field. Abstract. Mode of administration of homeopathic medicine has vital role to play in bringing a change towards the cure. Dr. Hahnemann himself searched and experimented with different mode of administration of dynamic medicine of homeopathy by trying to apply through the different conventional mode. Oral, tactual, and olfaction being widely accepted, and conventional practice for administration dominated in every system of medication. So Dr. Hahnemann himself also tried many mode of transmission, just not only giving the oral medicine, but also he tried many of the other mode of transmission such as tactual, olfaction. So oral administration instilled in all medicines principles became the instinctive mode of administration, both for the practitioners as well as for the patient. Discovery of Dr. Sahni, transmission of homeopathic drug energy from a distance, is a breakthrough in the mode of transmission. In our present case study on applicability of the distant mode of administration of homeopathic medicine, we took up cases of hypothyroidism. Selection of homeopathic medicine was done in most classical way by following the totality of symptoms as prescribed in the homeopathy. Selected medicine was administered from our OPD to the patient residing at their dwelling place through a hair taken out from them. Results were observed for the change and followed up with the progress of most classical way of homeopathy. Kane's observation for the subsequent changes was strictly adhered to make subsequent changes in medicine as well as their potency. Patients were followed up even after the laboratory reports were proved to be within the range to observe for any relapse. Homeopathic drug administrations through transmission of medicine from a distance through hair for hypothyroidism patients are quite effective mode, most compatible with the homeopathic principles. Recent development in Dr. Sahni concept of distant administration is article of Dr. M.K. Sahni was published in Journal of Critical Reviews, ISSN 2394-5125, Volume 7, Issue 15, 2020. Homeopathy medicine, magnetic photon, teleport form a distance through hair entangled particles. As a therapeutic intervention, homeopathy is somewhat target of enhanced skepticism because with the main, its remedies are diluted and succus, potentized out of fabric existence. This puts homeopathy seemingly at odds with the paradigm of conventional science, especially that atoms and molecules are the elemental building blocks of all matter. And each atom has electron, proton, neutron, and own energy level which exist in nature. So every particle features a specific energy and wavelength and frequency. Now that molecules potentized, so molecules is converted in its energy. Magnetic photon, because every mass is converted to energy and energy is converted to mass. Energy is neither created nor destroyed. Energy may be conserved quantity. The law of conservation of energy states that energy is often converted in form, but not created or destroyed. Dr. Karen Langer, homeopathic potencies, identified the new magnetic resonance method. Their electromagnetic properties are demonstrated by a fairly new developed resonance method using two different Tesla coils which generated longitudinal wave at distinct resonance frequencies within the high frequency range at low microvoltages when led into the maximum of magnetic field. Therefore, it can be concluded that homeopathic potency consists of magnetic photons. The conclusion is the clinical trials has proved that distant application of medicine is now not a dream but a reality. So here I complete the presentation on the transmission. So
thank you, Megha, for your nice presentations. You have explained the things very positively, and I feel that you have understood many of the topics about it. And definitely it is going to be a thought bearer light for showing how the medicines can work, and it will build confidence in among many the use of the homeopathic medicines from a distance. And you have also presented the recent development that has taken place by publications in the critical journal. It was my article, critical review magazines, which is an international peer review journal. Definitely the world are showing interest among the transmission of homeopathic medical medicine. So we did speak in spite of several obstacles. When the objective work is clear, when there are the sincerity and objective, even that hurdles, today presentations is proved that even after so many hurdles that we had as a starting problem, that it went to a great success. Now with this, we have some time left, and I feel that there may be some questions on the chat box. So can we have the Dr. Jessica? Any questions are there?
Yes, sir. There are a few questions for Dr. Bipin sir and Megha ma'am also. First question is from Dr. Gopal. For Dr. Bipin sir, in the above case, should interrogation and counseling of parents is required? Sir, your audio is off. Sir, Bipin sir.
Yeah. Can you repeat the question?
Yeah.
In the above case, interrogation and counseling of parents is required or not?
At this age now, she is already 40 plus. So, I mean, if it would have been a childhood, it would have been possible. Now things have moved beyond. Now they don't become a part of it, the whole resolution. So if it would have been an early childhood and the children experiencing this, probably it would have been possible at a very early age. Yeah.
Another question. I think this is not a question. Dr. Natalie is requesting for the notes. That's it.
Notes. This is you going to make this presentation available to all? If they want to read more on magnesium, the symposium volume of ICR F section has got a good graph of magnesium. I mean, that is one of the original papers written on magnesium, because it's not well proved or well practiced medicine for so long at level of mind, except a very central idea of being orphan. I mean, she can refer there, and if this video is available, I think this can form a part of notes.
Yes, sir, absolutely. This video will be available on YouTube. And also there is a question for Dr. Megha or Sahni sir, whoever wants to answer. Is electro-homeopathy concerned with homeopathy or is different? I think Dr. Sahni...
Let me reply this question myself.
Yes, sir.
What the audience has asked about the electro-homeopathy and this transmit homeopathy. So now it is very clear that electro-homeopathy is not what we are doing. It is what we are experiencing with the transmission. We are using the pure homeopathic medicine. And in electro-homeopathy, it is a different system of medicines, which is quite different, and it has the philosophy and the principles and law are quite different there. And they are using some different type of the herbs which is not included in the homeopathic system of the medicine. Whereas in this drug transmission method, it is just an extension of the homeopathic philosophy, because we are following the law of the similia, the law of the minute dosage, law of the similars, everything is being followed. Only the mode of administration, which is also in accordance with the Hahnemannian conception about administering the medicines in the different way that he has tried and experimented during his lifetime. In 283 FIM, he is very clear that homeopathic medicines can be applied with the olfactions, oral, and by tactuals also. And he also compared that effects with the mesmerism also. So we are just extending and trying to find out the different approaches of that can be applied. This is quite, it must be kept clear in mind that this method is simply a mode of administration of the homeopathy. How the medicine, there are different modes, and for every system there must be a definitive mode of administration. So for our homeopathic medicines, where dynamic properties are to be administered to the patient, we have to think about how the dynamic property of the medicines can be administered to the patient. And this is just an experimentation which was done by Dr. B. Sahni and now being experienced Today also you saw the two cases presented by Dr. Krishnamurari, where he has applied the method for his cancer patients, and Dr. Vikram Goswami, he has applied the system to the paralysis patient, where they got the wonderful results to it. And they have not. I have observed these phenomena, and now it is quite clear that these medicines are not a substance which can be swallowed through the mouth. We have to just accept the reality. This is very important for us, accepting the reality about us. Simply denying that this homeopathic medicine is not effective, or this way is not effective or effective, it is not in the scientific approach. The scientific approach is to be the dare to be wise, what Dr. Henneman has conceived in his organon of medicines. All these chapters, concepts will only make the acceptance of any system or anything and make the scientific spirit. This is with the scientific spirit. We have to take it as a, not as a skepticism. We have to take it as a that whether it is possible, how it is possible. So we have to further explore. Like so many opportunities are there, so many things are that can be done. She has nicely explained that there are many questions arising now. What is the wavelength of Nux vomica? What is the wavelength of belladonna? What is the wavelength of energy property of this or that? This is very important. So there are so many potentiality of the fundamental research in homeopathy is required. And this thing will come, definitely will come, the time will come that these things will. What Dr. Henneman has done, he was criticized for using the medicines in such a dilute form. Thereafter, it got accepted, and it took 250 years to get accepted. So, friends, the only thing is that we have to be very courageous, because Dr. Henneman has rightly said, "Odd sapiens, dare to be wise," and this is the only aspect, scientific approach Dr. Henneman has given. If you want to practice something in which you believe, you have to stand firmly. You must have the determination for that. So, I think I have gone much beyond that. So, Yasika ji, I'm. Any more questions are there?
Online class.
Dr. Yasika, I think she is not in the room.
Hello.
Okay. She must be joining. She must have got connected. And I don't find any.
There is no question.
There are no many questions. There may be on the YouTube channels also. Questions are recorded there also. So she will be able to get it out. I am thankful to the audience for their patience hearing, that in spite of the so many hurdles that we had to face today, this program came to a success, and I think soon Yasika will be joining. Yasika ji ko phone. Soon she will be joining. Sorry, Yasika's laptop is crashed program, and she cannot join now. So with this, anyone who want to share some views? Dr. Jain, Bipin ji, you want to say something? You please put on your
It was a good opportunity to participate in this. So I thank you from bottom of my heart. Once again, you have been very kind to me for inviting me. So that was and then I also listened to the scientific part of it. So it was a good experience to be part of the whole thing.
So, Dr. Bipin, what I can say, I am the admirer of Dhawale sir, the senior, all the generation of the Dhawale sir. And they have definitely paved a new path for the new concept of for learning. The way you have explained the phenomenological understandings about the medicines, I think it is going to make the things very, very scientific. And this is possible only when try to have the sincerity in learning. What I feel that the education system must be upgraded to the next generation. So since she will not be able to join, we are now concluding this session, and with this, this session is closed. Thank you. Thank you all.
Thank you. Thank you, sir.
Thank you, everybody.